Doug, as always. And I've got to admit, Governor Patrick, I was somewhat amazed because most governors come up here and they have a laundry list of changes they'd like to see to health care plans. Yours was not a laundry list, so it compelled me to look at the experience that Massachusetts has. And what I found was the federal participation in Massachusetts for Medicaid went from $5 billion in 2005 to $7.5 billion in 2010. At the same time, the state's share was $4.9 billion in 2005 and dropped to $4.7 billion in 2010. I can sort of understand why you're an advocate of it, because the federal government continues to pick up a larger and larger share of the health care cost of the Medicaid population. Bruce, real quickly, should means testing become part of the Medicare structure?
We already means test in effect very significantly on the revenue side of Medicare. To means tested on the benefit side is both an administrative nightmare and I think is a move away from the fundamental principles of social insurance.
I take that as a no. Do you agree that the creation of IPAP and empowering them to make reimbursement decisions was the right move?
My understanding of the logic of IPAD, Senator, has a lot to do with the way in which the Congressional Budget Office and other budgetary scorekeepers look at the world, and I have real qualms about that. I'm very sympathetic to Senator Rockefeller's points. On the other hand, I'm also familiar with the history of the Interstate Commerce Commission and other efforts historically of the Congress to delegate responsibility for setting prices when it felt itself politically unable to do so. We have in effect, at the moment, the United States Congress as the court of last resort on payment rates under Medicare to, I think, an excessively detailed degree. This is a very difficult problem in public administration, and I'm not sure the IPAB is the right answer, but I'm very sympathetic to the notion that the Congress hasn't distinguished itself particularly in that regard in recent years either. So I don't know quite what the exact right answer would be.
Yeah, and I think the point Mr. Holtz-Egan was saying was that if you empower a body to set reimbursements, you have now empowered a body to affect the scope of coverage.
I do not believe that. I don't believe, if you look at all of the effort both the Congress and CMS devotes for changing reimbursement levels, providers always claim if you take a nickel out of their payment rates, people aren't going to be able to get service. 98% of the time, those claims turn out to be wildly exaggerated. And I can cite chapter and verse, Senator, in that regard.
Under Medicare, it's believed that 40% of primary care docs will not see a Medicaid beneficiary, and that 70% of specialists will not see a Medicaid beneficiary. Does that affect their outcome of care?
Absolutely. Medicaid patients have great difficulty in access to care in some communities more than another, and one can only imagine what would happen to those problems in a block grant situation. That's why the CMS has finally, belatedly, issued regulations to begin to figure out how to define, let alone not even to enforce, the access provisions in the statute. And that's why many of us are so unhappy with the Obama administration's position on the lawsuits to which several members have referred today.
The decision to either see by primary care or by a specialist is because of the low reimbursements.
Absolutely. Absolutely.
You agree that 40% of primary care and 70% of specialists won't see?
I'm always a little skeptical about those numbers, but in general, that's a very
well, the analysis
they correctly define a very real problem.
The analysis published in the New England Journal of Medicine last week underscores how children on Medicaid are having a problem with access when seeking an appointment. 66% of those who mentioned Medicaid or CHIP were denied appointments compared to those who said they had private insurance. It's real. I mean, this is New England Journal of Medicine. And, you know, I'll end because my time is up, but Governor Patrick, you said in your testimony, and I quote, "Stick with what works." Now, I think the whole debate that we're having is, does Medicare, does Medicaid, as currently constructed, work? To me, it's appalling that you could have a system where 40% of the primary care docs and 70% of the specialists say, I got to tell you, I'm not making enough to see these kids. That's an injustice to the kids. It's a flaw in the system. It can't be something that's working because all the information tells us it's not. My hope is that we will work aggressively to change it. I thank the chair.
Thanks, Senator Nelson.
Governor